I got to start with the big news, and that is teachers. The news coming out of Clark County is that the school district students will be starting this school year, remotely, following a unanimous vote from the school board yesterday to approve a full-time return to distance learning. Trustees requested that they receive updates every 30 days, which I think is appropriate, on the status of COVID-19, with the aim of eventually transitioning to a blended learning model if health conditions allow, even though there's no definitive date set for students when they might return back to the schools. Many teachers have also said they would prefer distance learning. With the Clark County Education Association survey of over 11,000 teachers, they found that 74% favor the model over school buildings reopening. I think that is very, very important. 3 out of 4 teachers agree with this. That's a big deal, right? That's important, and this comes at a time where Nevada just reported 28 new COVID-19 related deaths, and they're breaking hospitalization records for a second straight day. That's right, 28 new deaths, and 26 were reported right here in Clark County in the last 24 hours. These are not made-up stats. And over the course of the past 2 or 3 weeks, recent COVID-19 data shows Nevada is continuing to set records for cases and hospitalizations and ICU patients and ventilator usage. That has nothing to do with testing. That has to do with people that are simply getting sick. And after falling for months, now the COVID-19 hospitalizations, not just in Nevada, but across the country, are on an upswing, and they're approaching the peak level since April. And the reason is simple. The U.S. is experiencing a surge in cases, with states such as Florida, Texas, and California reporting thousands of new confirmed cases in recent weeks. At the peak of the pandemic, and this is very important because listen to these stats, at the peak of this pandemic, it was in April, we had close to 60,000 people that were hospitalized nationwide. That happened on April 15th. According to the COVID Tracking Project, that number reached its lowest level on June 15th. But guess where we're at right now, folks? 58,330 as of July 20th. Just a hint behind April high. And this is the time you want people to be going back to school, kids and adults? Give me a break. Give me a break. So we had a Foothill High School special education teacher on with us yesterday. Great woman. She was very honest and sincere. She obviously cares about her students, but she cares about her own life too. Yeah, I don't blame her. Her name is Jen Ice. She appeared on the show yesterday, and she said she does want to go back to work, but she wants it done in a safe way. Have a listen to her right here.
I say that I'm not opposed to opening schools as long as it's done in a safe and smart manner, provided that there is a budget put in place to put in safety protocols. So my biggest concern, and I can speak for at least my social circle, is that if there were, new air filtration systems, if there were air filters in the classrooms, if you could guarantee keeping kids 6 feet apart, then sure, it's not that the teachers don't want to go back and teach. It's not that we don't want to work. We want to work in a safe environment. We don't want to be the canary in the coal mine. I've been staying home since March. I am getting stir crazy like everybody else. I'm doing the best that I can. But then, you start talking about, well, there is a real possibility that I could die from doing my job.
Damn right. How could anybody disagree with her? Well, some people did yesterday. We had a woman named Jennifer who is a complete disgrace. I was shocked. She calls into the show after the interview. Listen to what she said about that teacher who we had on, Jen Ice. Listen to this.
You can put a mask with the whiny teacher, and we're like down in the lowest level of schools, like with Louisiana and the Appalachians.
Wait, I'm sorry, with all due respect, did you call her a whiny teacher? Is that what you just said?
Whiny, overpaid, and she's
okay. Whiny and overpaid. Now, I lost my mind when she said that. I really did. I really lost my mind. But luckily, we have some intelligent people that listen to this show. We had a woman named Lorraine who called up, who thought that woman was a complete disgrace. Here's what she had to say about it. Your side, yeah.
Whining bitch. I would like to know what the frick she's ever done for work.
Yeah, you know
and
what?
She was paid for it.
You're right, Lorraine.
She's as ignorant as they get.
Yeah, I agree. As ignorant as they get. I could not agree with that more. Absolutely and positively disgusting that there are people out there that will say those things about teachers. Oh, and then we got local radio host and disgraced radio host Wayne Allen Kook. This is what he had to say this morning about teachers. Quote, I have a message for teachers who don't want to go back to work. You must be non-essential. If so, you should all be fired. Because policemen and firemen are essential. They must work, no choice. Cops and firemen are alive and well, surviving COVID. Why can't you? I suggest you snowflakes find another job that pays $60 to $100K with best health insurance in the world, plus full pension, plus 4 months off for summers and holidays. Good luck. Trust me, welfare doesn't pay as well. Time to choose. So this guy's a disgrace. This guy's a human piece of garbage. But what he said in there is very interesting because he said cops and firemen are alive and well. Well, that's a complete lie because thousands of firefighters and police officers have contracted the virus, and close to 100 police officers have died in the last several months due to COVID complications. That's right. I know that's a shocker to a lot of people that somebody like Wayne Allen Kook would say something that's a lie on the radio, but that was a lie. And yes, we have people out there that are attacking teachers, many of whom are making under $40,000 a year. That's right. I said it yesterday, and I was right. The national average of teachers is around $39,000 a year. But let's attack the teachers because they want to be safe. Let's attack the teachers. It is the new talking point on the right, and it is disgusting. I want you to have a listen to Missouri Governor Mike Parson. He went on St. Louis radio, and he gave his opinion on why kids should be in the classroom. Have a listen to this.
These kids have got to get back to school. They're at the lowest risk possible. And if they do get COVID-19, which they will, and they will when they go to school, they're not going to the hospitals. They're not going to have to sit in doctor's office for days. They're going to go home, and they're going to get over it. Get over it.
Now, I just gave you all the stats. I just gave you what's going on here in Clark County, what's going on in Nevada. I gave you the death toll. I gave you the hospitalization rates, the ICU rates, by the way, going on across the country, not just here in Nevada. But we have a Missouri governor who goes on a radio show, and he gives his opinion, and his explanation, just get over it. I just told you all the police officers that have died throughout the country from this virus and those who have been infected. But we have idiots like Wayne Allen Kook and the Missouri governor and people who called into this show yesterday. Luckily, there were not too many of them, but a few that are going after teachers and calling them whiners, saying that they should be fired. Well, what do you think about that? I'll give out the number, 702-257-5396. Again, the number to call if you want to be a part of the conversation is 702-257-5396. Do you agree with some of these people on the right that are calling these teachers whiners? Do you agree with some of these people on the right? What do you have to say? What do you have to say about that? Attacking teachers, saying they should be fired, that they're a bunch of whiners? Really? How could anybody agree with something like that? Again, that number to call is 257-5396 if you want to be a part of the program. Let's go to Sean. Sean, you're first on the Vegas Take. What's going on, man?
How's it going, Brian and JD? How you guys doing this morning?
Good.
Hey, I've been listening to the show off and on the last couple of weeks and regarding the whole school district and the COVID-19. And I think I've missed your opinion on the whole COVID thing in general. What's your opinion on all these cases that are coming up with that, you register to go take the COVID, you take the COVID test, you don't go get the COVID test, and yet you get a letter in the mail saying that you tested positive?
Well, I don't know how many times that's happened throughout the country, and I don't know anything about that. I really don't have an opinion on it because I don't know anything about it. What I do know is that there are some reports that have come out, and those reports came out that also said that it's quite possible that COVID has been under-evaluated as far as how many cases there are out there. So, I mean, what I'm talking about right now is the school system, right? What I'm talking about, and with all due respect to you, Sean, I think that's a conspiracy theory. What I believe is that these teachers and these students, we should value their lives. Doesn't mean that they should never go back to school. Doesn't mean that they shouldn't go to school at all. But what it does mean is that we need to be very careful. And what I'm upset about, Sean, are people that are attacking teachers throughout the country. That's what I'm upset about.
And I totally understand that, and I agree with that. No teacher should be attacked.
Right.
But I do also think coming from the school district, especially out here in Clark County, that there's a lot of teachers out here that that get overbearing. I'm trying to think of the right word to say.
Okay, that might be possible, Sean, and I understand what you're saying, but let me put it to you this way. It's kind of like my mom. I'll put my mom into this conversation. I would rather have a mom that is over-loving and overbearing than the opposite, to have a mom that doesn't care about me. And I make that analogy because it's the same thing here.
And Sean, you mentioned those tests. Sean, you mentioned those tests that have been actually, I can tell you for a fact that in Omaha, Nebraska, a very good friend of my parents, they signed up to take a test. They went down there. The line was extremely long. They ended up not taking the test, and they found out a week later that they were positive. And here's the reason why. Because right now, when you sign up for a test, the only way that's possible is if all the tests are set up for default positive. And if the doctors don't change that, then anyone who signs up for a test who defaults and doesn't take their test is deemed positive. That's why it's happening all over the country. So, Brian, it's not a conspiracy theory. It's actually taking place all over the place.
Okay.
And the last couple of days, I'm hearing more and more about it.
Well, here's what I'm hearing more and more about, and this is also not a conspiracy theory, that throughout the country, including here in Nevada, hospitalizations are up, ICU patients up, and ventilator usage is up. So we can talk about how people are getting not tested positive and they're not positive, but that doesn't change the fact. Hold on a second. That doesn't change the fact that hospitalizations are up, not just in Clark County and in Nevada, but throughout the country in many spots, and ICU patients and ventilator usage. That has nothing to do with over-testing, and to me, that just puts an end to that conversation. Why are people being hospitalized? Why are people sick?
That doesn't put an end to the conversation at all. I mean, if that's taking place, that's a problem. If people are being called positive when they don't get their test because of the default structure, the way that it's in the system, that's a huge issue. Now, that being said, cases are up roughly 3 times what they were from back in March and April. So, yeah, of course there's going to be an increase in hospitalizations and deaths. But in comparison, I mean, the highest amount of deaths was 2,708, and that was in, I believe, early April. Yesterday, there was 1,112 deaths. There hasn't been over 1,000. That's the most deaths there's been since June 10th. So cases are up tremendously. Okay. Deaths are down significantly. So obviously we're doing a significantly better job of handling this virus, and it's not circulating through the nursing homes like it has. Even in Florida, though, where there was 140 deaths today and yesterday, 50% of those deaths are taking place in nursing homes, roughly.
So I know you want to talk about nursing homes, but let me just give out a stat again because you might have missed it 10 minutes ago. 59,000 people on April 15th were hospitalized nationwide. That was the highest amount in one day. Guess what happened yesterday? The number climbed back to 58,330. We're not talking about positive cases. We are talking about hospitalizations.
Okay, so then by that logic, then there should be 2,500 or 2,700 deaths in the next couple of weeks.
Again, if you want to correlate that to deaths, go right ahead. I'm not going to do that.
By that logic, that's what it should be. And as far as the teachers go, Brian...
Hold on a second. So what are you saying? That number I just gave is a lie because the deaths aren't up?
No, I'm not suggesting that it's a lie.
What do you mean when you say that?
I'm saying that the death rate, the mortality rate is dropping.
I know you said that.
So the deaths aren't going to catch up to that, in my opinion, based on what's happening.
Okay, so in your opinion, because the deaths aren't there, we shouldn't take this seriously? 58,000?
Well, like, for example, I'm not saying we shouldn't take it seriously. Like, for example, in Florida yesterday, Governor Ron DeSantis said that they have 20% hospital capacity and 25% ICU bed capacity. So their hospitals are fine. Despite the fact that their death rate, I think it just climbed to 1.4%. Mm-hmm. Nevada is 1.8%. New York and New Jersey, you're looking at 8%.
Well, let's get back to the phone calls, but I just gave you the stats of how many people now are hospitalized, and I'm not going to undervalue that by saying, well, the deaths are down. That's me. I'm not going to do that. Let's go back to the phone calls at 257-5396. I think Paul is next on the Vegas Take. What's going on?
Hey, what's up, Paul?
Hey, guys. Hey, listen, I when this first started looking really serious, I went to California. I have an 80-year-old mother, and I told her, you have to live with me because I have to be able to keep an eye on you. Also, I work retail, and the retailer that I work for, I probably cross paths with 1,000 people a day. And I would not attack teachers for not wanting to go to work. But having said that, I've always worn a mask ever since it started. I haven't caught this thing. It doesn't mean you can't catch it. But I think that the reason that maybe people are attacking teachers is that some of the ridiculous school districts have made demands like, we'll come back to work if and they want things
Yeah, and you're talking about like the LA teachers union,
exactly.
which made a bunch of demands like free health care, and they basically made socialist or communist type of demands. Or otherwise they weren't going to come back to teaching.
What about the state?
And people aren't. They're also not thinking about how these kids are affected. Like for example, there was a study done in Wisconsin on high school age athletes. 68% of high school age athletes in May reported having severe depression symptoms. They're estimating that 66,000 people, or high school athlete age kids in Wisconsin, just Wisconsin alone, are going to have to deal with depression because of the pandemic. Okay. So they're not thinking about that as well.
So because kids might be depressed, we should have them all go back to school and put them arms. No, that makes complete sense.
Kids being depressed leads to death, just like teachers getting the virus leads to death. Brian,
so kids are going to die.
There's two sides to every single situation.
If we don't bring the kids back to school, they're all going to die because they're depressed. No, you make complete sense there, JD.
Not only that,
that's very sensible.
What do you?
I think what you're saying is ridiculous.
It's not ridiculous,
It's a
Brian.
Donald Trump talking point.
It's not a Donald Trump talking point.
So the kids are going to die if they don't go back to school. Give me a break. That's insane.
Did I say that?
Well, you're saying they're all going to be depressed and they're going to die.
I didn't say they were all going to be depressed.
That's stupid.
I said, how is that stupid?
I think that's stupid. Yes, I think it's. Show me a study that shows if kids don't go back to school, they're going to die. Come on, man.
Brian, show me a study that says if teachers teach, they're all going to die. Come on, man.
Sure,
you can't either.
Sure.
Exactly.
Let me
no,
answer
you can't.
That. Well, would you like me to answer?
Do you know why you can't?
No, I
because,
can.
No,
here's why.
No.
You asked me a question.
I'll tell you why you can't.
You just asked me a question.
Because
now let me answer it.
Here's the deal.
So you don't want to let me answer your
mortality.
question.
Well, I'll tell you. I know you can't do it.
Let me answer it. How do you know that if you don't let me answer it? It's ridiculous.
Fine.
I'll give you a stat. Over 140,000 people have died from this virus. Let's go back to the calls. 257.
So that means every single teacher is going to die?
Did I say every single teacher? That's another stupid comment.
That's what you said to me when I said that 68% of students that are high school age athletes are going to get depressed.
I didn't say.
Not only that, you're not thinking about what about the kids right now that instead of being involved in sports, I'm not talking just high school, but what about elementary age kids that aren't being involved in sports, that are now just sitting at home on the computer, watching Netflix, being sedentary, eating. You're going to see obesity rise as well. So all that stuff needs to be factored in when you make that decision about bringing kids back to school, as well as the parents.
We only have
not being able to
45 seconds. So all that stuff that you just mentioned. Whenever you mention things like that I could not disagree more, I always asked you, what does that mean? Does that mean you think Clark County, the school district, made a mistake, and you think all schools should be open throughout the country starting in August? Is that what you're saying?
Absolutely.
Okay. Well, I couldn't agree with you more. I think that's completely ridiculous.
You're welcome to disagree, but don't call it stupid.
I think what you said, your opinion is stupid. I'm not calling you stupid. I think it's stupid to say kids are. That's what Donald Trump does. The kids are going to be depressed. 68% of kids are going to be depressed. So some way, we don't want kids to be depressed.
Do you know how many kids that'll be nationwide? Brian, that's just in Wisconsin.
All right, where did you get that stat from, by the way?
That was a study that came out 2 days ago.
From who?
It was a University of Wisconsin study.
So University of Wisconsin did a study showing that 68% of kids that don't go back to school are depressed. Funny, when I didn't have to go back to school,
on high school athletes. Yeah,
on high school athletes.
Yes, on high school athletes. That's what I said. High school aged athletes.
I know these poor kids can't play football. I feel so bad.
It's not just football, Brian. There's a lot more that goes into it. There's camaraderie. There's getting sun. There's a lot of things you have to factor in that you're not thinking about.
I have to factor into a break right now. 702-257-5396 is the number to call. We'll take all your phone calls on the other side of the break, and we'll be back right after this. You're listening to the Vegas Take. All right, welcome back. It is the Vegas Take. Sharp and Shapiro. We're talking about the Clark County School District and the decision they made yesterday. Kids will not be going back to school. There'll be an assessment every 30 days at the start of the school year. And then we have people like Wayne Allen Kook and some people who even called into the show yesterday that were calling teachers whiners, including one of the teachers we had on yesterday that was concerned about her health. I don't blame her. People going after teachers now. That's right. It's the new talking point now for some. Go after teachers. They're overpaid and they're whiners. So what do you think about that? We're taking your phone calls at 257-5396. Let's get right back to our busy phone calls. Let's go to James. James, you're next up on the Vegas Take. Thanks for your patience. What's going on?
Hey, what's up, James?
Hey, well, since they're going to start with the off-site learning for the kids, about 2 weeks ago I saw in the news the Las Vegas School District was going to spend $45 million to add artificial turf to the football fields. And I'm thinking maybe they want to redirect that money to Chromebooks so all of the kids can learn from home because they're delaying the football season anyway. And
I don't disagree. I think that's a good idea. I agree with you.
I think that's a lot of money that,
Sure.
And like we're saying, the most impoverished kids are going to suffer the most.
Absolutely.
They're going to be missing meals. They're not going to have, the means to learn online and things like that. And that's where I think leadership, comes under fire is when I love football, man. I played high school football. I played college football. Mm-hmm. But, you got to be crazy to think that that's more important than learning, and these kids.
Well, I agree, James.
They need all of this stuff, man, so they can learn.
Yeah. Well, James, I couldn't agree with you more.
James, it's all part of development.
I agree. I know you need to be fully rounded. My kids played sports. My daughter, who was a senior, she missed out on graduation.
Well,
my other daughter's a cheerleader. She's not going to be able to do any of that. But
it's horrible.
They still have to learn. And
no question. No question, James. And good phone call. And let me just say this. You're absolutely right. Money should be allocated towards other things right now. I certainly agree with you. 257-5396 is the number to call. Judith is next. Judith, what's going on?
Hey, Judith.
Judith? Judith! She's gone. 257-5396. By the way, one of my favorite A Perfect Circle songs is called Judith. I just thought I would throw that out there. 257-5396. Mike is next on the Vegas Take. Mike, what's going on?
Hey, what's up, Mike?
Hey, how you doing there?
Good.
I thought I'd chime in here. It's like, this is a double-edged razor because we got a couple of things going on here. Number one, follow the science. Nobody's really following the science. Everybody's following the emotion. So as far as the schools being closed, like I said, double-edged razor. You get the schools closed, it's because of a lot of fear-mongering, because we can't, number one, trust a lot of the media. Number two, it's like, it's got its perks, too, because it keeps the kids from being indoctrinated.
Okay, so let me respond to that. First of all, so I just reported to you that 28 deaths yesterday in Nevada. They're breaking hospitalization records for the second straight day.
Brian, that was lagged because there were 0 deaths on Saturday and there was 1 death on Sunday.
We just lost the call. Just let me finish with some of these stats. Yeah. Close to 60,000 people throughout the country are hospitalized. These aren't just positive tests, hospitalizations. That is the highest since April 15th. That has nothing to do with the media. That has nothing to do with fear-mongering. So with all that being put into place, there are teachers that are very concerned. There are a lot of adults. We're not just talking about kids, teachers, administration, custodians, you name it. All the adult security that are in the school system have a right to be concerned. And a lot of these teachers do want to go back to work, but they want to plan and they want it to be safe. Let's get back to the phone calls at 257-5396. Chris, you're next. What's going on?
Hey, Chris.
We lost Chris. Let's go to Brian. Brian, what's going on, man? You're next on the Vegas Take. What's up? Wow, we've pretty much lost all of our callers today.
We're 2 of 7 right now. We're almost as bad as Fauci is with his guesses on what's going to happen with the virus.
Okay, well, I certainly disagree with that. 257-5396. But again, that is another right-wing talking point.
No, it's not.
Yes, it is.
It's not a right-wing talking point.
Find me a Democrat
Brian.
that's going after Fauci.
Right-wing talking points aren't true, right? This is true. Anthony Fauci
has gotten everything wrong, and he has no credibility.
I said 2 for 7. I didn't say everything. I said 2 of 7.
Find me a scientist or a doctor in the history of this country that is perfect, that has never gotten anything wrong.
Well, there's a difference between 6 of 7 and 2 for 7,
All right.
Brian.
So let's listen to Donald Trump talk
Same
about...
with 5 for 7.
Fair enough. Let's listen to Donald Trump talk about injecting people with disinfectants over Dr. Fauci. 257-5396 is the number to call. Let's go to Lewis. Lewis, you've been waiting patiently on hold. What's going on?
Hey, what's up, Lewis?
Hey, guys. Okay, so you're absolutely right about the numbers and hospitalization rates and all that, and that is true. And the beautiful thing about numbers is numbers don't lie. And here's another number for you, the 98% survival rate. So that number is true, and you can manipulate it and say there's 8 million, 10 million, 1 billion people that die, but that's only still 98% of the people are going to survive.
All right, let's go with that.
And here's another number for you.
To school, guys, if I can finish, June 29th, U.S. News and World Report, American Academy of Pediatrics, an organization of 67,000 pediatricians, 67,000 of them say the kids should be in school.
Mm-hmm.
Now, don't you like science?
Sure, let's talk about that.
And data. Science and data.
That kids should go to school.
Sure, so let's talk about that for a second. Let me start from square one. You brought up the 98%. Let's assume that is 100% true. Of the thousands of employees that are in Clark County that are teachers, the thousands of adults that are in these schools, are you okay looking them all in the eye and say, well, if you get COVID, there's only a 2% chance you're going to die? Are you comfortable in talking to these adults that way and talking to a custodian, maybe somebody that has been working in the school system for 30 years? And hold on, let me just finish the question to the caller. Are you comfortable going up to these adults and saying, well, listen, sir, if you get or ma'am, if you get the virus, there's only a 2% chance you're going to die. I'm not going to be in the schools, but you should be there. Are you comfortable in saying that?
And before you answer that question, question,
you know what, Brian?
Yes.
If I can answer for you, I've got my wife, who's an essential county employee, who's in the courts.
Okay. And
she just got tested, and everything that you're discussing, I have no problem.
You have no problem.
Well, okay. And also, one thing Brian is not discussing here, Lewis.
To work and doing what she's supposed to do.
Lewis, one thing Brian is not taking into account here is the median age of those who have died of COVID-19 is 78 years old. So how many 78-year-old teachers are there? Probably a lot less than 30, 40, 50, 60-year-old teachers.
Well, you can go to school and you can do their job. I'm not going to do it.
That 2% is actually significantly lower than 2%.
So let's undermine the virus again.
The average age of someone who died, you're talking about dying, 2% dying. That's not even remotely true if you're 40 years old, 50 years old, 60 years old. Now, if you're older, it's high risk. Actually, right now, if you're 85 plus, you have a 2 times better chance of dying this than the flu.
So what have we learned since this show has started? We've learned that only old people are dying from this virus, so don't worry about it. Go back to school. It's okay to attack teachers. Don't worry about it. And I feel sorry for the athletes because 67% of athletes in high school that can't play sports are going to be depressed. So let's let everybody go back to school. Okay. What do you think about that? Do you agree with JD? 257-5396.